We're good.
All right, so we are going to be presenting our International Health Promotion Program. And my name is Madison, and I'll be identifying the need and giving support with reliable and valid references. All right, so next slide. All right, so in the world today, there are many suffering from a lack of sanitation facilities, clean water, and basic hygiene practices. According to the WHO UNICEF Joint Monitoring Program for Water Supply and Sanitation, 32% of the world's population, which is approximately 2.4 billion people, have lack improved sanitation facilities, and 663 million people are still using unimproved drinking water sources. Inadequate access to safe water and sanitation services, coupled with hygiene practices, sicken and kill thousands of men, women, and children every day. This leads to impoverishment and diminished opportunities for thousands more. Without water and sanitation and proper hygiene, sustainable development is impossible. All right, next slide. All right, in this article titled Inside the Syrian Refugee Camps, Where Childhood Doesn't Exist, by Time Magazine, we learn about the refugee camps in Jordan. And this article isn't about the refugee camps in Turkey, but it still gives the same idea of what's happening over there. So here are a few excerpts. Every day, thousands of Syrians flee their homes. The once stable country is experiencing an exodus on a scale that the world has not seen since the Rwandan genocide more than 2 decades ago. More than 4 million Syrians are now hosted by neighboring countries, while an additional 7.6 million people have been displaced within Syria. The Syrian revolt, which began in March 2011 in the southern city of Daraa, just north of the Jordanian border, propelled hundreds of families to cross the frontier on foot at night. Many people reported that while the official UNHCR-run camps have better facilities and support, they'd feel trapped and crowded there, and they seek greater sense of community and independence, preferring to move around and find work outside to provide for their families. Yet the conditions are undeniably harsh in these unofficial desert camps, with high temperatures during the day and extreme cold at night. One reports that he was especially aware of the lack of sanitation and medical care in the camps. Barefoot and malnourished, many of the children bore the additional mental scars of the war that they had fled. Many young boys were described as speaking and acting like men. Although some of the settlements have makeshift schools donated by UNICEF, classes are taught by other Syrian refugees and are not regular. Instead, many children work with their parents in nearby farms run by local Jordanians. With some 86% of refugees in Jordan living below the poverty line, refugee children are frequently the main breadwinners for their families, and UNHCR worries that a generation of youth are forfeiting their future by missing out on an education. All right, next slide. All right, so in the map displayed, we see that the top countries, what top countries are hosting the most refugees back in, and this was taken in mid-2015. As you can see, Turkey is one of the top 5 countries that are currently hosting the most refugees. According to this study performed in mid-2015 by UNHCR, the refugee Syrian population grew by more than 300,000 people during the reported period. Surrounding countries continue to be impacted heavily by the crisis, with the number of registered Syrians in Turkey, Lebanon, Jordan, Iraq, and Egypt remaining high. All right, next slide. All right, just kind of as a quick side note, Hollywood star and UN Refugee Agency advocate Angelina Jolie met Syrian refugee families living in the squalid conditions in Lebanon on the 5th anniversary of the Syrian war, which was just back a month ago on March 16th. Jolie reported, "We should never forget that for the focus of the refugee situation in Europe at this time, the greatest pressure is still being felt in the Middle East and North Africa, as it has for each of the last 5 years." The star, who has visited Syrian refugees in Lebanon before, appealed to governments around the world to set up their assistance to nearly 5 million people who have been forced from their homes because of the war.
Page 9. It is our goal. Yes? It is our goal to help the refugee mothers and their children with a life-saving wisdom and fund that can be implemented through the WASH program by putting our own spin on it. We think this program should be informational, but bring about the use of the Syrians' own songs and language. Culturally, as people, these refugees may not have the same understanding of the benefits of the hand washing prior to eating and or following the use of the restroom. Now more than ever, the hygienic practice needs to be brought to the forefront of what we need to help the refugees to understand. The risk of disease expands to a new high as refugees pour into camps and into urban areas where there are already millions of people living in close quarters with greater possibility of unsanitary conditions. Next slide. We believe that this can be done with a degree of lightheartedness where we encourage without being discouraging. We show by example through song and bright cartoon-like illustrations how the simplicity of rubbing hands together with water and soap can stop the spread of disease and possible death. And through this slide, we can see that there are many things going on in the world with the WASH program that we would like to incorporate, and we feel like there are several ways that this can be achieved. Next slide. Through a school setting, medical observation, and humanitarian efforts with the LDS missionaries, with vast resources from our own scouting, young women, and Relief Society programs, as well as partnering with agencies and other humanitarian organizations. The opportunity to gather hotel-sized soap and put them together with hygiene kits and possibly donating drawstring bags is endless. We have also contacted other businesses such as Melaleuca who would consider collaboration with international agencies as a way to charitable donations to this plan. And through this plan, there are several other plans, including the WASH program through International MedCorps that work with Global Soap Project and Clean the World. Next slide. And through this slide, we can see that there are many other UNICEF, the International MedCorps, the LDS Humanitarian Services, that all work together to bring soap to the needed areas. Next slide. And again, this shows that we can use different organizations in a collaboration to bring these to the different areas that need to be in Turkey. We have talked with many programs, and it says to begin this program would have to be done through persons or agencies that are already on the ground in Turkey and have the knowledge of the people and the language. Resources of the LDS Mission Department have humanitarian missionaries who serve in those refugee camps as well as in the larger cities that currently house refugees. With 1.8 million refugees currently moving in and out of Turkey, the program to instruct must be short, sweet, and worth remembering. Next slide. In the United States, children are taught to wash their hands to the ABC song. The Syrians have an upbeat song called the Chicken Song, and it's just the right length of time to wash with the appropriate amount of time. With our own tiny soap and a song, the sequence of washing can be taught even to the smallest refugee. Next slide. We want this to be a learning experience that brings fun, information, and in doing this with songs and bubbles, hopefully the children will embrace this activity. We will reinforce this activity with the teachers in the schools and encourage them to continue the same kinds of trends, not only with the refugee children, but with the children who are native to Turkey. Next slide. Hygiene can be integrated into learning as they learn to count during the washing of their hands, recite their alphabet, poems, songs, or just about anything they are learning. Visual pictures that are bright, fun, and vibrant in key locations of their world will help them to see and then do. Perhaps bubbles as a tool can be integrated in a fun portion of this teaching process. teaching the children to blow bubbles through the thumb and index finger, reminding them that this can only happen if they use soap to get rid of the germs in their hands. Next slide.
So there were a few barriers that we have found that we needed to overcome to be able to implement this plan. We needed to have trust from the refugees. We needed to have support. We needed to be able to overcome cultural barriers, and we needed to have incentives that would be fun and rewarding for those that participated in this program. The first one is trust, and how do we gain the trust of the people? How can we get them to listen, and who do we address first? So the first thing we thought was, how would we react to an outsider that came into our community and started telling us or our kids what to do? We would first have to have that trust. So we decided that we would work closely with the medical workers that have already built a relationship with the refugees in giving them medical help and meeting their medical needs. We also would try to go through religious leaders that were there or any community leaders that everyone looked up to. We also thought the best way to gain support would be through families themselves, to gain the trust of the mothers or the fathers of these kids, if they had any. We would try our best to show that we wanted the best for them, that we are here for their well-being, and that we really wanted them to be able to implement this plan to make sure that their families were safe and that these kids were able to be safe. The next barrier was support. How do we show support for these people, and how can they support each other? I think sometimes people go into these programs thinking, the refugees are thinking that, well, if I do this, if I wash my hands, then I'm going to have to give them something in return. I'm going to have to do something for them or pay them back somehow. And we want them to know that we really are truly concerned for their health and that we don't want anything in return, and that they can support each other and help each other wash their hands, help each other monitor the hand washing, help each other monitor their kids washing their hands, and that's how this program is going to work. Another barrier was through the culture. How do men and women interact with each other, and who makes decisions for the families? So we weren't sure of, there's specific cultural rituals or do's and don'ts that may hinder our progress. So, we have to make sure that women are allowed to talk to men outside of the family, and if it's not okay for those, for the women to talk to men, then we need to make sure that we have a lot of women throughout our program that can communicate directly with the women, or vice versa, with men communicating directly with men. We wanted to make sure that we address those needs by having a great group of both men and women that are trained to help and communicate with the refugees. And the last one was incentives. How do we reward the kids? How do we reward anyone that wants to wash their hands? How do we supply the soap, and how do we keep up with the demands? So we wanted to be able to have an incentive that would be really exciting for the kids to wash their hands, and we thought of having food or candy, but then we realized that children could lie about washing their hands because they were hungry. We didn't want them to feel like they were being punished if they didn't wash their hands, but we wanted it to be a reward. So that's how we came up with the idea of giving the kids a new bar of soap as a reward for washing their hands each day of the week. We also thought of how we were going to monitor this practice, and thought of having group leaders, or having kids in charge being the group leader that week, so that they can make sure each person was washing their hands, showing each person how to do it, singing the songs with them so that they knew that they were washing their hands for long enough, and these group leaders would be given an extra bar of soap for being in charge, and it would place more excitement on being the leader. We also wanted to make sure that we had extra bars of soap so that we could give out these incentives, that we could keep up with the demands. So we thought we could work through LDS Charities and have the bars of soap provided by Eagle Scouts scout projects or young women personal progress. We've also talked about the local company that Kim mentioned to see if they would be willing to partner with us to provide this up for us. So these were the barriers that we saw and that we've really tried to overcome.
So some of the concern, whenever you're developing a program, there's going to be concerns that will arise based on culture, or as some refer to the resources. Are there habits that they have in their culture that would be contrary to what we're trying to accomplish? Are there social norms that we need to go over? Do they understand germ theory? These were some of the things that were brought to our attention. Or is it simply because of resources? Remember, we're dealing with a group of child refugees is our target audience. So they have issues such as space, language, transportation, registration requirements, a belief of returning home one day, finances, and also the survival priority. So according to the Avencia Journal for Medicine, who conducted relief missions and subsequent surveys in refugee camps, they found that none of the responding physicians found cultural competence or language a barrier to what they were trying to accomplish in those areas. So then, is it a simple lack of resources? Very much it could be. Through our research, we found that it can be a lack of resources, but it also can be a lack of knowledge. When the Syrian crisis started, back in about 2011, the population had a pretty high rate of enrollment in education facilities. But now, after years of turmoil, there are children that were too young to have gone to school before the crisis began. And they've been in that survival priority. There are reports that as many as 40% of refugees are still not registered in a school program because of needs in the family. These children have potentially grown up in circumstances where their survival took priority over teaching correct hygiene practices. Next slide, please. So, as an example of the education barriers, just in Turkey alone, there are more than 400,000 Syrian refugee children living in Turkey that are not attending school. So that's one of the main issues that we need to address, is how we can teach these people. Go ahead to the next slide. So monitoring. One of the questions was, can you monitor people that are washing their hands? We thought about direct observation. Doing it all the time is kind of out of the question. We thought it might be possible in some situations if there was a process to wash your hands before you receive, food allowances or rations when you're in the camp situations, or start a program where gathering all together several times a day to do it together. But it seems to be a big prospect, and it's not. The people we're dealing with are not always in camp situations. So the follow-up question for that was, should we be monitoring the hand washing practices? And in all reports, we should. In a report from Caritas, it's one of the it's a camp, they said using hygiene intervention, they found it more effective to find native spokespeople that could encourage others to engage in better hand washing practices. And this is a quote from one of the people that was one of these native spokespeople. He said, when you become a teacher, you don't expect all your children to be the same. Some will be very bright, and some will be slow and won't understand. We need to be persistent, come back a day later, and bring others to explain. Over time, people come to understand. Patience has paid off. You can really see the difference. Go ahead to the next slide, please. So who do we need to teach? First of all, we need to teach the families. So in other WASH programs, they found barriers. They found that the barriers, enabling factors, and motivations for hand washing in long-term refugee populations were similar to non-camp rural settings in developing countries. Some of the barriers included prioritization of soap used for laundry over hand washing, enabling factors including having a convenient hand washing station, and motivations included disgust, properly nurturing children, and the comfort of having clean hands. Demonstrations to interested mothers at homes of those already using the practices were found to stimulate interest and action. They found that they could get groups of mothers to look at hand washing station designs and discuss ways in which it could be improved or adapted to their specific situation. Many messages based on the desire to properly nurture their young children and providing comfort of having clean hands should be able to introduce and promote proper hand washing. Now, while mothers cited disgust as a motivation for washing hands during focus group discussions, they generally felt that comfort and properly nurturing their children were more relevant. So what kinds of things could you train people to understand? How to understand the reasoning behind washing your hands? Germ theory isn't something that everyone understands. So one example comes from a refugee camp in Africa. The research found evidence to suggest that emotional and sensory levers, such as disgust and the desire to properly nurture children, can be effective motivators for hand washing with soap, particularly after bathroom visits. When they go to the latrine and wash your hands with only water, they tell people that only the smell remains. But when you wash your hands with soap, there is no smell. And they found that to be an effective way to teach those things. School is another way that we can teach our target population. There was a recent study done in Egyptian schools to see the benefits of hand hygiene in their population. Next slide, please. They found that, and this is this middle data here, they found a reduction rate of absenteeism of 40%, a reduction rate of diarrhea by 30%, 67% of conjunctivitis cases, and 50% of influenza cases. And this is schools where they implemented wash programs and sanitation education. So for our conclusions, we found that through proper sanitation and wash practices, it reduces all those incidences. And in the next part below, the reductions in the diarrhea occurrence, 5% came from the water supply at the source, 36% came from sanitation interventions, 19% of the benefit came from water quality interventions, and 47% from hand washing with soap. According to some of the studies that have been done by the World Health Organization, it said if we are able to provide basic, low-cost water and sanitation options countries needed, the world would save around $263 billion a year. If everyone in the world had access to this kind of knowledge and resources, the reduction in diarrheal-related disease alone would save $11.6 billion in health costs and treatments, and would in turn generate $5.6 billion in labor spending through this.
All right, so that was our wash implementation program. Thanks.